today we will discuss about posology. Posology, which is the branch of homeopathy. First we discuss what is posology. Poso means how much, logos means to study. So is about our introduction in the posology, that posology is the doctrine of doses of medicine. So what does means? It deals with the doses of medicine, homeopathy doses or allopathy or any system of medicine. Their doses is deal with the branch which is known as posology, and it is an important division of pharmacology. Pharmacology is what? It is the deals with the preparation of drugs. So preparation of drugs and the study of the drugs. So and its doses. So posology is also is the branch of the pharmacology. Then another point which is mentioned that in the introduction, that a doses, how we give a doses to a person or to an individual. It mainly depends upon the individual tolerance and susceptibility. So what does it mean? Tolerance and susceptibility. Tolerance and susceptibility. So doses according to the tolerance. If a person having more tolerance, then we give more power of doses. It varies according to the system of the principle. Now, how much quantity of a drug we should give? It is defined as it is the quantity of a drug substance which is required to elicit the desired therapeutic response of the individual. So when we require a person to remove his diseased power, then that much amount of quantity we should give, so that the disease causing pathogen will elicited, and we wanting desired or wanting therapeutic response will occur inside the patient. So that is that much amount of quantity we should give a person, and this quantity or dosage deals with the posology section of the pharmacology. Then homeopathy does, it is general, that the dosage and the quantity of a drug both are which we discuss. It is general about any medical science, but homeopathy medical science deals with the dosage according to their potency, quantity and the number of administration of the medicine. So potency means the strength of the mother tincture or drug power, that is our potency. Whereas quantity means same thing in a different way, that is the quantity of the material dosage, means the drug which we take, and administration of a medicine means how much we repeated the medicine. That thing deals with the homeopathic dose. Then our system, other system of the medicine means our allopathy, Ayurveda, all types of Ayush and medicinal, all type of medical system, they deals with the doses by these eight factors. What are that? Body weight, body area, sex factor, time, place, emotional factor, biochemical individuality, tolerance and idiosyncrasy. So these are the 8 factors which we always take to in account for the calculation of a doses. Now homeopathy posology. Now we go towards our main topic, that is homeopathy posology. So homeopathy posology, what it says? Homeopathy posology is the important one of our pharmacy. Why? Because it is the essential factor. Because if a doctor having low knowledge, having difficulty in the dosage selection, then the remedy which he or she selected for a patient will be vanished or will be does not use. Because of this, homeopathy posology is a great important role during the clinical life. So what are the factors depends upon homeopathy posology? That is, homeopathy posology depends upon the principle, remedy, and doses relating with the potentization. So we discuss all by one and one. So first is the homeopathy principle. What it says, that homeopathy posology principle says that we deals with the doses of the medicine of the homeopathy drugs according to variety. That is, one is homeopathy pharmacy, another is organon of medicine. We also deals with the homeopathy posology by another principle is that Newton's third law. We know that Newton's third law says that action and reaction are equal and opposite in nature. So what does it mean? We discuss by giving an example of homeopathy practical, that is our opium. Opium is a narcotic substance, is a analgesic, or it is just as a opium poppy food, that is our this. If opium is given in a large dose to a person, then there will be deep sleep occur. But if it is a one case. Another case we discuss that opium with large dose, action and its reaction is deep sleep, whereas necrosis in small dose, in opposite action with opposite reaction, that is sleep on those deep sleep which is occur by the opium will be cured by giving necrosis or necrosis, that thing. Then remedy. So what is remedy? Before we go towards the remedy, we should know that physiological action of a drug. What does it means? That homeopathy remedies, we should important here, that here a point is important, that is the thing that homeopathy remedy means the indicated medicine for a person, means by a mental general constitution temperament we selected a medicine for a person, and this medicine is known as a remedy. After we choosing a remedy, we give doses according to the homeopathy principle and homeopathy posology factors. But first thing, we selected a remedy according to the organon of medicine and our mater medica. So homeopathy remedy is always important, that it does not use by the physiological effect of a drug. So what does it means? Means physiological effect of the medicine. That when we selected a remedy, we does not use the physiological effect. Physiological effect means the remedy which is selected is not in a lethal or toxic or large dose. That is the physiological dose. By a great homeopathy doctor says that physiological option of action of a drug is not its therapeutic or curative action. It is exactly opposite to the curative action. What does it mean? That the physiological action of a drug means we study before that the pharmacological action of a Nox vomica, which in the Play Store you can see that the Nox vomica having the physiological action is that when we give Nox vomica in a large and lethal dose, then what happened? There will be dysentery like symptoms appear, which is the physiological actor, which is the physiological dose. But when we deals with the our homeopathic remedial doses, Nox vomica used for what? Used for the constipation. So from this example we clearly indicate that physiological action is the exactly opposite to the curative action. Then next thing, our remedy is complete. Now we go towards the doses and related to the potentization. So what does it mean? So homeopathy cure when occur, it is obtained without any other suffering or drug symptom by minimum dose. So first thing which we remember that from this line, that minimum dose. Another thing is that we in the homeopathy cure obtain, we do not have any other suffering or other type of a symptom should not be found. So homeopathy cure when occur when there will be no another suffering or symptom will be provided, not formed by minimum giving minimum dose. What does mean minimum dose? Minimum dose means in the low scale potency. What does means low scale potency? Low scale potency means where the material part of the drugs remains silent or remains attenuated by the succussion and trituration, which we discussed before. That a similar homeopathy drug is the administered in a disease. Why we use similar homeopathy drug? Because it is having little or no resistance upon the disease causing pathogen or upon the body, and it does not have any new symptoms of the disease, but having removed the before symptom which is appear by which we want to remove. Then homeopathy drug act in a manner similar to the action of a disease producing cause. So homeopathy drug, how it act, its action is similar to the disease producing cause. So the amount of a vital force is affected, such amount of a drugs will be required to act on our body, so that the vital force becomes rearranged and our body becomes cured with physical and physiological and pathological. All types of cure can be occur by giving similar doses with a similar disease pattern. Now dose is made so small. Why we give in homeopathy? Why we give doses in a small dose? Because there will be no produce any pathogenic symptom or any severe aggravation of the already existing symptoms. Those symptoms which already exist and which causes dearranged morbid action in our body will be not aggravated. So we use dose in a small scale. Then another point should remember action of doses, that drug should be given in a single with a small dose. Small dose, why we discuss, but why single? Because by giving single dose, its action will be complete, means we can find complete action of a drug. But if we give two drugs, we cannot find which drug cure the patient. So for single use of a drug, we can have a definite, clear, complete crystal idea about the action of the single dose, and which can unmodified by any other drug. Means if we give another drug with two drugs in one time, then what happened? The action of another drug is different with respect to first drug, so that there will be intermingled of the action of the curing of the disease occur. So we should not have give many doses in a single time. We should give a drug in a single with, so that we can find the action with a complete form and which cannot be modified by any other drugs. Now the point is how to select a dose. So which is a very much important topic or subtopic of the posology, because if a doctor will failed in the selection of dose, then the remedy will be failed and the disease never be cured. So how we select a dose? So selection of doses is depend upon three types which written our books, that low potency is 24x, means 24 decimal scale and 12 centesimal scale, up to 0 to 24 24 decimal scale, up to 0 to 12 centesimal scale, where the drug power belongs to the 12C, where the drug power becomes 1 by 10 to the power 24. So up to this drug power or potency we consider as a low potency. Then transition potency means intermediate potency, means between the 24 to 200x. So x represent here what? Decimal scale, where C represent the centesimal scale. And a high potency means above 200x, which we can say 100 centesimal scale. So what are the responsible factor for the selection of a potency? Five things. 1, 2, 3, 4, 5. The successibility, the seat of the disease, the nature and intensity of the disease, the stage and the duration of the disease, then the previous treatment. So we discuss all by one. Susceptibility of that patient means the more the susceptibility of the person, the lesser the medicinal quantity. Means the crude form of the medicine should be less, so that what happens, the higher potency will require. When a person is having more susceptibility, more prone to disease, then we give more doses. But these things is not by only judging on one factor. All factors get together, combined, then we select a medicine. Only depending upon one factor we can't judge a selective ideal potency. So we should always remember that susceptibility of the patient. If we go for the susceptibility of person, we first discover that if the person is more susceptibility, then we give higher potency. Less susceptibility, we give lower potency. So what are the factors determine the susceptibility? Factors responsible for age. Age is the another one factor. What is in age, what we find that if the person is child, then we give low potency according to the susceptibility of the patient. If the child is adult, then high potency. If the person is old, then we give low potency. Why? Because child are more susceptible to disease, with also the old having more susceptible to disease. So we give low potency. But in adult, we give high potency. High potency means more susceptibility. So this thing which is written, you having more confusion, but you should remember that this thing, because susceptibility of the patient is not depending upon the age is not a factor to determine a dose. There are many factors which we come across one by one. Another thing is temperament and constitution. What does mean temperament and constitution? So temperament means the nature of the person, whereas the constitution means the by environment it changes its nature, which is not its original nature. So this thing comes under mathematica, but here we only discuss that which potency we select for the temperament. So high potency in the temperament, which type of individual we give high potency? Those individual having sensitive, nervousness, sanguine or choleric temperament, and those individuals which are intellectual person, means those are intelligent and quick to act and react, and the jealous, impulsive person. Impulsive means very quick, very active person. Then which individual we give low potency according to their temperament and constitution? That is a sluggish or coarse fiber individual with the gross habits, torpid and phlegmatic person who are slow to act and dull to comprehend, person who possessing great muscular power which require to stimulus excite them. So this person will give low potency. Then which person will give medium or transitional doses? Those are oversensitive patient who any medicine, if we give a normal medicine or placebo also be sometime works. So these are oversensitive patient which needed medium or low potency. Idiosyncratic patient means those person are morbid or they have don't doll like behavior. So these person also give medium potency are preferred. Then we go towards the habit and the environmental factor. So in habit and environment, which individual will give high potency? Those having intellectual occupation, means they are teacher or some intelligent occupation or intelligent job, they are giving high potency, they are needed high potency. and those who are suffer from bad effect of excitement from imagination and emotion. Those are emotional people also have high potency. Those are sedentary occupation also need, means sedentary means they are just like comfortable zone. These are also give high potency. Those are want to long and sleep 8 hour 10 hour maximum time sleep. These are also give high potency. Now lower potency is given according to their habit and environment. Those are who physical labor, outdoor labor, eat coarse food. Means they are nothing like fibers. Fibers, proteinous food are not present in their food. Coarse food means not fine. Adapted to little sleep, only small amount of sleep, 2 to 4 hours. Tobacco, narcotic substance, or sometimes liquor, they are addicted person. They are associated with drugs, perfumes, and chemical environment. Those are idiotic, invisible, deaf and dumb. So what we discuss this in interterminal cases where gross pathological are changes, when a person having so much fibrolytic, so much pathological means the constitution or the skin and a superficial layer of the body will damage, then this time we select lower potency also. Then seat of the disease. Seat means the place where the disease present. That is important. That important organ or greater pathology will give the more material dose, means lower potency. Material dose if more, then potency will less. That is the thing which we know before, that if the organ will be brain or liver or heart, then we use lower potency doses. Then the nature and intensity of the disease. According to Dr. Elizabeth, he says that functional disease with subjective symptoms respond well to high potency, and organic condition respond to lower potency. So what does it mean? Means those are subjectively we describe that which type of a disease is, then we use high potency. If the organic condition means we are objective to see the symptom, then we use lower potency. In acute diseases, the susceptibility is high, so we give high potency. Sometimes acute paroxysm of chronic diseases, we use lower potency. So chronic diseases, what it means, that with no organic changes, we use 200 potency. Why we use minimum dose? Because minimum dose will not aggravate the previous symptom, also can enhance the curability or removal of the disease. So that is the thing. Then if the organic changes will occur, then we use lower potency. Then the stage and the duration of the disease. If the disease is not curable, then we give lower or medium potency, because lower or a small dose will give more benefit towards the disease removing. But if the disease is chronic or cancer-like disease, then we give high potency. Then the previous treatment. What does means previous treatment? Means if the person having more peculiar or more characteristic symptom, or the remedy appear by one scene of the case, then higher degree of susceptibility we say, then we choose high potency. And if the disease or previous treatment is a decisive amount, then we use minimum or infinite scale disease. So in this way, the factors of the regarding the posology selection we discuss. Now we discuss one thing, that is the proved by observing the doses. So in this way we completed our today's topic, posology and homeopathy. Thank you.